Hello all, my name is Dr. Prathap Kumar Reddy, Consultant Radiation Oncologist at AOA Guntur. Today, April being Head and Neck Cancer Awareness Month, we are going to briefly discuss about the risk factors, symptoms as well as preventive strategies of this group of cancers. I will, with the help of few question and answers, give the better awareness of this group of cancers. First question, what is the most common risk factor for oral cancer? First option, smoking and chewing tobacco. Second option, poor oral hygiene. Third option, lack of vitamin D. Fourth option, less physical activity. Correct option is smoking and chewing tobacco. Smoking and chewing tobacco is the most common cause of oral cavity cancers. Smoking in any form of like cigarettes or cigars or pipes, as well as chewing tobacco and snuffing the tobacco is also the major cause of getting cancer in the head and neck malignancies. The other risk factors of getting head and neck malignancies are human papilloma virus, excessive alcohol intake, excessive exposure to sun, and low intake of fruits and vegetables, and any chronic irritation with the ill-fitting dentures can cause to oral cavity malignancies and head and neck malignancies. Second question, which of the following is not a symptom of oral cancer? First option, sore on the lip or inside the mouth that bleeds easily and don't heal within 2 weeks. Second option, difficulty in swallowing, speaking or moving jaw on tongue. Third option, red white patches in the mouth. Fourth option, frequent nasal bleeds. The correct answer is frequent nasal bleeds. The remaining three options correlate to the symptoms of the oral cancer. The last option, frequent nasal bleeds, does not correlate with the head and neck malignancy. What are all the symptoms of head and neck and oral cavity malignancies are any persistent sore, any lesion that does not heal over the period of 2 weeks or 10 days, and anything that swelling or lump in the oral cavity, and change in voice and difficulty in opening the mouth. These are all the symptoms of head and neck malignancies. Coming to the third question, how can oral cancer be diagnosed? First option, blood test. Second option, biopsy. Third option, X-ray. Fourth option, urine test. The correct option is biopsy. Biopsy 100% confirms the diagnosis of cancer. In the biopsy, what we do is we take a small piece of tissue from the suspicious lesion that is present in the oral cavity and send it to a pathologist who sees it under a microscope for any abnormal cells suggestive of cancer. If there are any suggestive of cancer, abnormal cells are there in this and the biopsy specimen what we have taken from the suspicious lesion, then cancer is diagnosed. This is the 100% confirmatory test of cancer in the head and neck region. So biopsy is the mandatory test. Coming to the next question, which dental examination technique is essential for the early detection of oral cancer? First option, X-rays and imaging. Second option, palpation of the neck and jaw. Third option, visual inspection and oral examination. Fourth option, salivary testing. The correct option is visual examination and oral examination, inspection and oral examination. Visual inspection and oral examination are the initial steps of diagnosing the cancer in the oral cavity, because in this step we see any abnormal signs or symptoms are present in the oral cavity, suspicious lesions in the oral cavity. Thereby we can do a biopsy from those early lesions which are present in the oral cavity. So this step is very, very important for diagnosing the oral cavity cancers at a very early stage, and thereby diagnosing the disease at the very early stage we can cure the disease completely. So this step is very, very important for early detection of oral cancer. Thank you.